Hello, my name is Dr. Lucas Watterson from Mountain State Wellness in Morgantown, West Virginia. And the message I would like to teach you today is this. Most of the people that consult our office to help restore their health have had some type of head, neck, or spinal injury many years ago. Oftentimes, when I review the health history with the new person in my office, I'll see that they had an injury sometimes 10 years ago, sometimes 20, sometimes even 25 years ago, that they didn't connect the two together, the prior injury and their current circumstances or current symptoms as they're presenting, as being the cause of their situation. And I have to tell you that that frequently occurs. And here's 3 examples that recently consulted my office, so you can begin to see that if you've had an injury, even though it was many years ago, 10, 20, or even 30 years ago, and now you're starting to develop strange neurological symptoms in your body, of which nobody else can help with, all the medical personnel and doctors have examined you and found nothing else to be the cause, I would strongly encourage you to consult our office. The first person I want to talk to you about is a 40-year-old male that recently consulted our office that, as he told me in his health history, he drug a deer out of the woods a year ago and then started having left-sided paresthesias, where he's numbness and tingling down the left arm, down to his left leg, into his feet. But then as we began to examine his health history, he told me that he also took an elbow to his face 20 years ago and broke his nose and injured his teeth. And I said to him, dragging the deer out of the woods may have caused stress to your spine. I said, but I'm certain after you've told me about the broken nose injury you had 20 years ago, that is what actually injured the top of your neck. And it's been sitting there waiting for you to address it. And now we're starting to have these left-sided neurological symptoms, which I believe are going to completely resolve once we actually correct his spinal alignment. The second example is a 44-year-old woman who consulted my office recently, and she came to me with mostly headaches and neck pain, but also some other strange neurological symptoms. She was having blurry vision, she was having ringing in the ears, she was having stuttering and slurring of her speech, and then some other strange facial paresthesias, numbness and tingling and pain and so on and so forth. And we began to talk during her health history, and she said, nothing's really happened to me recently. I've had no accidents or injuries. I don't understand this. All of a sudden came on about 7 months ago. And I said to her, well, let's go further back. And it just so happened her sister was in the room at the same time. Now remember, this is a 44-year-old woman, and her sister's in the room. I don't know her age, but similar in age. And she said, oh, do you remember when we had the sledding accident 24 years ago when our brother made a ramp and we're coming down the hill and we went up the ramp on our sleds and you crashed and bent your neck back and injured your neck and you actually couldn't move for several minutes afterwards? Yes, this particular woman said, I do remember that story. That is when she misaligned her spine. And now, 24 years later, she's having all kinds of strange neurological head, neck, and shoulder symptoms. The third and final person I want to share with you today is a 30-year-old male that consulted my office recently. And he pretty much has migraine headaches, neck pain, and then kind of upper shoulder and upper back pain that's just constant and chronic. He feels like he has a vice grip kind of on his shoulders that never really lets go because the muscles are so tight. And we began to discuss through his health history, and we realized that 7 years ago, he was in a very terrible motor vehicle crash. And he talks about how in his history, these symptoms have recently begun to develop and become worse, but at the same token, he mentions they've kind of slowly been there for a very, very long time. And so I assured him that when he had the car accident in 2018, that yes, that's what caused his initial spinal injury. So here's what we do at Mountain State Wellness when these people consult our office. We practice a very specialized and little known procedure called upper cervical care. And what upper cervical care is we specialize in detecting and correcting injuries to the top of the neck. We have people that travel to us from all over the state of West Virginia and Ohio, Maryland, and Pennsylvania to consult our office to get relief and recovery from these types of injuries. We use very specific spinal examinations. We do a neuromuscular examination. We do a balance test. And then we take very specific 3-dimensional digital images of your neck, one from the side, one from the front, and one from the top, to actually measure how much displacement you've had due to your injury and how far in which direction it's actually moved. And then we calculate mathematically how we're going to correct your spinal misalignment. Everybody that consults our office is uniquely different, and everybody has a very specific care plan and a very specific correction process. After we make the first correction, we take a second set of pulse x-rays to verify that we have the best alignment possible in your scenario, and then we simply maintain that with a frequency over a period of about 6 weeks, and we see all these symptoms that have been present for 10, 15, 20, maybe even 25 years begin to disappear on the people we care for. I want you to know that there's no medication or surgical procedure that can correct the injury to the top of your neck. Only upper cervical care can do that. If you've been suffering for many years and you know you've had some kind of injury, whether it be 10 or 20 years ago, and now all of a sudden you're having poor health and neurological symptoms, and someone's told you there's nothing else can be done or no one else can help you, please consider calling our office. We can help you. My name is Dr. Lucas at Mountain State Wellness in Morgantown, West Virginia.